Hi, my name is Jessica Jones, and for the career profile that I did, it was a substance abuse counselor. So it's kind of interesting. So basically, the example organization that I chose was a like a health center. If I could talk, Health Central. It's actually a clinic. It's located in Wisconsin, so I thought that was kind of cool. The working environment that I found out was obviously you're working in a crisis center, which I mentioned. It includes walk-in clients, calls, or outpatient services. You are working with clients who have been hospitalized for greater than 72 hours, and you may also be working with patients from the client's family, so like family members that might be struggling with what's going on to a beloved, family member. Typical stressors that are part of this job is the actual clients itself. You have to be able to handle the problems they're going through, and not only theirs, but several others. So you're not just focusing on one person, but several other people. You can't let it become a burden on you, and I feel like some people take other people's problems on, so that would be an issue if you had that, and that would definitely be a stressor because you were worrying about somebody's other situation when you could be suffering your own situation. You also have to expect the unexpected. You don't really know what patients are going to do or say, and so you have to be able to act quick and understand and see see different types of situations and be able to respond to those in the appropriate manner. Typical benefits is obviously you're helping somebody, you're changing their life, you're helping them change their life and to get on a better track and not to be tied down by a substance. Common job tasks in this job are the specific job that I was looking at were timely completion of psychosocial assessments, complete the hospital substance abuse evaluation form within 24 hours of a client admission, and you also have to know you have to have a knowledge of dealing with client behavioral problems and also a basic background of psychology and sociology, things like that. So some educational requirements that I found is a bachelor's degree in either social work, sociology, or a related field. And I actually looked it up because I was like, oh great, family's not going to work for that. And it actually said that a lot of substance abuse counselors have a degree in family and marriage. So it was kind of interesting. So you also have to have a minimum of 1 year experience before working as a substance abuse counselor. You also have to have no prior felonies or convictions for crimes in relation to harm to yourself or another, theft, misuse, or misappropriations of a legal or illegal drug. Your starting salary range is it's an hourly based job, but our starting salary wage usually is about $38,000, and then you can make up to $60,000. Oh, sorry, the medium amount that you can make is about $38,000, but a lot of people start off at $23,000, but you can make up to most around $60,000. So that's kind of interesting. And really, an interesting thing that about the job is you actually are working with kids 13 and older. So you're obviously working with adults, but you can be working with 13-year-olds, and it's kind of that can obviously be an emotional thing. And so it was really interesting to read about that because I didn't think you would be working with such young adults, but you are, and that can also be a stressful thing as well. So that's it. That was all I had to say about that. And I think substance abuse counselors can make a really big difference. And I think it's a really neat thing that just because you didn't, maybe major in that or get a degree in that, you can still be able to help in that. So yeah, there you go.